You may be anxious and uncertain about how to get medical care during this time. Spectrum Health is ready for you with extra safety measures in their facilities, and this includes a new curbside check-in at the urgent cares right here in Kent County. So Paige Bolt with Spectrum Health Medical Group is here today to share more about this and what you can expect if you or a loved one needs urgent care. Paige, thank you for joining us today.
Thank you for having me.
Yeah, so today's message is really important. There are so many people that are really concerned about going in to receive medical care due to the pandemic, but your message today is don't put your health on hold. Why is that so important, especially right now?
I mean, good health has always been important, and even before the pandemic, but even now, especially during this time, it's very important to seek proper medical care. There are several conditions that if you delay care, they can become worse over time. So for example, a simple bladder infection, if you don't go in to get medical care due to concerns or fear, that bladder infection may progress to a kidney infection and become more life-threatening. Additionally, simple lacerations or cuts may become infected or less amenable to suturing or repair. So it's very important not to delay the proper care and to still get that quality care that these patients in our community needs.
Yeah, a lot of people are thinking that when they do have medical issues, the best thing to do right now is to visit their primary care physician or to just give them a call. But the urgent care center is much different. So can you tell us a little bit where someone would need to make that decision, whether to go to their primary care physician or visit the urgent care?
Yeah, certainly. So it's always good if you have questions or starting points to call your primary care office to get direction. The urgent care facilities are equipped to handle kind of medium to higher level illnesses. Obviously, if it's more life-threatening, such as chest pain or difficulty breathing, you should always call 911 or go to the emergency room. But we're able to manage many conditions, such as minor cuts, bruises, broken bones, lacerations, tick bites, allergy reactions, many conditions. And so, like I said earlier, if you have questions, calling your primary care doctor is a good starting point. But there are several people in the community that don't have a primary care provider. We can provide services to them as well.
Yeah, and we're seeing information about the urgent care visits right now. Medium to high severity health needs. This is when you should make that appointment and go to Spectrum Health. A lot of people out there that have cardiovascular disease or have stroke in their family, if they're sitting at home and they feel some of those symptoms coming on, but they don't want to go into an urgent care center or they don't want to go to the hospital in fear of COVID-19. What should someone be thinking of, and how do they make that decision?
Yeah, it's tough. I've been trying to encourage my patients, try to think of your health. Obviously we can't ignore the fact that we're in a pandemic, but Spectrum has done an amazing job to make sure that we are providing safe and quality care to the community amidst all of this. And so I always encourage my patients, and I ask them sometimes, would you have come here versus the ER if COVID wasn't occurring or we weren't in a pandemic? And sometimes that's a hard question, and we are kind of this middle zone of providing care between primary care and emergency or hospital. So we never would want someone to not seek care. And if someone comes here and they do need a higher level of care, such as the ER or the hospital, we're still going to get them that quality of care. It's not going to be a matter of, oh, you're not at the right location. It's let's work on you until you get the higher level of care, and we can get measures implemented while we transfer. So I think it's important that patients that have, more comorbid conditions such as, stroke-like symptoms or a history of stroke or a history of heart disease, still going with what their primary care doctor or their specialist have told them to do in the past. But if there's any concerns, we're always happy to direct them to the appropriate location as well.
Spectrum Health is taking extra precautionary measures during this time. And so I want to talk about some of these steps that are in place. One of them is being able to register online ahead of an appointment so people aren't waiting in the wait room. Can you talk to us about what that looks like?
Yeah, so we've always had our online tool for our 6 Kent County urgent care locations. This allows you to kind of reserve your spot in lines. That way, when you do arrive, you spend less time in the waiting room. But now, in addition to that, our 6 Kent County urgent care locations are now offering a curbside service and kind of what we would call like urgent care safe visits. So we encourage patients to register online, to reserve a spot. But then also when patients arrive here for urgent care visits, they have a curbside check-in. So there's signs outside of our facility to kind of direct their cars. We even register and get them all set up for the appointment and for the urgent care visit through their car. And then the goal is to bypass the waiting room, to lower exposure and transmission, and to provide a more safe visit. So oftentimes our goal is to have the patient go directly from their car to an exam room. And then in that exam room, they'll be assessed, they'll have their visit, and then when they leave the exam room, they go back to their car. So you can see we're bypassing and reworking kind of our structure and how we're seeing patients to provide a more safe visit for the community.
Yeah, Paige, so if someone's sitting at home and they would like to learn more information on how they would make an appointment and how they receive care, what would they need to do?
Yeah, so they can always go online. We have a website, spectrumhealth.org /ready for you. Additionally, too, I always encourage patients, if they're not sure, they have more questions, they can call any of our facilities. They can also call their primary care doctor. But I think utilizing the Spectrum website is a great resource because there's a lot of good information for where you should go and what resources are available to the community.
Yeah, and Paige, we know just talking about all of these extra precautionary measures, you're doing all of these things, but you're also doing the obvious things. You're wearing the PPEs and taking extra precautionary measures that we would expect. Can you elaborate on that a little bit as well?
Yeah, for sure. Spectrum has been screening all their employees every day they come to work. We are also wearing masks all day long at work. We are also screening all of our patients that come in, whether it's for a lab, a visit, an x-ray, or a visit with a primary care doctor or the urgent care. If you're entering our facility, you're getting screened. In addition to getting screened, all of those patients and even visitors, if they're allowed, are also getting screened, and they're getting masked regardless symptoms. So every employee, every patient, every visitor is masked. They're screened while they're here. We've taken extra precautions throughout all of our facilities to increase our cleaning measures to make sure that our surfaces and our facilities are sanitized. We are also scheduling appointment times with extra time in between patients to minimize wait times, to minimize that chance of waiting, outside of an exam room. We are also placing patients directly into the exam room, like I talked about earlier, to minimize contact. And additionally, we're also social distancing even at work. So we've really changed in promoting a lot of that here in our facilities to be safe as well.
Paige, thank you so much for your time. We appreciate it.
You're welcome. Yeah, thanks for having me.